As the rate of obesity in Canada has been dramatically increasing, it is time that the Standing Senate Committee appeals to the call to action to tackle this national epidemic. 70% of adults and 30% of children in Canada are overweight or obese. 1 in 4 meet daily requirements for fruit and vegetable consumption. 59% of Canadian children between 2 and 17 years of age consume fruits and vegetables less than 5 times a day, making them more likely to become overweight or obese. Obesity rates have tripled since 1980. Evidently, obesity is a national health crisis that needs to be immediately addressed. Industrialization has made foods more processed and calorie-dense rather than nutrient-dense. Our program, SCOPE, will address this crisis.
Our intervention to tackle this population-level issue is to create an experiential nutrition program that introduces multiple aspects of healthy eating. This program will be a new addition to the elementary school curriculum and will be mandatory from kindergarten to grade 5. The program will undertake a multidisciplinary view of healthy eating by focusing on issues at the individual and societal levels. It will offer a tactile learning approach to instill and develop healthy eating habits. Every year, the program will build on topics based on 4 centralized categories: food skills, food literacy, food in the media, and community education. Within these categories, students will focus on topics such as food preparation and enjoyment, reading nutrition labels, false food advertising, nutrition pseudoscience, as well as educational field trips to local food environments such as grocery stores, local restaurants, and food banks.
Initially, the federal government would have to provide funding to provincial governments to fund the program. The collaboration among the provincial ministries of health and education is essential for the success of this program. A needs assessment would have to be conducted in order to determine the resources needed to conduct the program in different school regions in each province. Based on this assessment, the funds would have to be allocated to regions that have more or less need. The schools would then be given a nutrition education syllabus for each grade that they can tailor to the needs of their school population. The Ministry of Education would have to conduct biannual surveys with the schools in order to assess the success of the program and the additional resources school would need.
This program serves many benefits towards the children's nutrition. With this program, children are introduced to a variety of flavors and types of produce with the intentions of having them develop healthy eating habits when they are older. Early introduction to a variety of fruits and vegetables has been shown to be a strong factor which links early childhood and adult eating habits. It has also been shown that fruit and vegetable consumption habits of children mirror those of their parents. Since only about 50% of adults over the age of 19 today are fulfilling their recommended servings, this program will work to help break the cycle of unhealthy eating. Children who eat well are more likely to learn better, be more active, and make healthier choices as they grow up. Since about 1/3 of what children eat and drink every day is consumed at school, the school plays an important role in helping students learn about healthy eating and also in helping them practice it.
Canadian children deserve the opportunity to learn the skills necessary to navigate the obesogenic environment that our society perpetuates. A curriculum that includes a novel approach through a variety of topics and a collaboration between all levels of government is essential to the success of the program. Curbing eating behaviors at an early age will empower children to take control of their personal health in the moment and into the future.